My name is Antonios Koumousidis. My position is consultant, obstetrician gynaecologist, working in East Sussex Healthcare NHS Trust, in Conquest and Eastbourne Hospital, and also in Sussex Premier Health, practicing privileges. I'm working in NHS for the last 11 to 12 years. And I have recently started the private practice in the relevant sector. I always, from when I was a kid, I always envisaging to become a doctor to help the population, people that face health problems. I was always finding that fascinating. Then I found out that I was able to do it, so I did well in the exams. I passed the medical school, where I found out in practice that that's what I was always liked in my life to do. So when I became a doctor, I practiced helping people, my patients. I started as a GP practice initially, getting into deeper understanding of several entities and pathology. Then I found out that I liked surgery as well, coming to my specialty, which is obstetrics and gynecology. After that, and I chose it. So obstetrics and gynecology is a specialty that involves not only medical problems, involves also surgical problems. So it gave me the opportunity to practice surgery a lot. That's something I like a lot. It gave me the opportunity to practice ultrasound as diagnostic tool. It is a very nice specialty because it has lots of communication skills that are demanded to carry out the several tasks and the job, and also to help the women and advance the women's health. So that made me quite interested in studying obstetrics and gynecology. As I mentioned, the most rewarding about my job is that the patients that I tend to see them again in occasions that they need me, of course. They need my practice, my help. So the most rewarding is that I see the patients most times to be happy after I have advised them, counseled them, or treated them. Fascinating is when I help a woman to deliver, have a baby. Also, when I treat women with gynecological problems, and you see how the effect of the intervention has gone, they become better. Also, this specialty gives me the opportunity to develop research skills, auditing skills, new methods that they come to the fore to apply them if they're safe to do so, to offer them to women and work together jointly for better care. I think what I have found is that patients are happy that I start from the very first time that they mention to me that they have a problem. And then I become dedicated with their consent to their care, diagnostically, by ultrasound or several tests that I suggest to be carried out. Then I advise them accordingly. And if treatment is needed, I'm there up to their treatment and after the treatment, if it's a surgery, post-operatively. Kind of auditing and logging also my practice with that, and deriving the satisfaction that I mentioned in the previous question. And that you can see that patients are recognizing that. Yeah. I value that most of my patients have the culture to share, to be open and share with me their problem and allow me to work jointly with them for their care, allowing me to get them involved. So this culture is something that I value most for the patients, because I feel that I can practice safely in that case. I feel that anything happening is not going to get missed, and the patient is in the center of the care, being in charge of their care. And I value most of, for my patients, most of all, I value this. Yes, I have some stereotypic phrases, but lots of times I cannot recall them, of course, because even I use them all the time. They are phrases that are coming naturally to me, so they are not on purpose. But what I can remember from, at the moment, the most usual phrase I use is at the end of the consultation. I almost always say to the patients, either discharging the patient or going to see them again the next time, I always mention that if they have any problem related to the problem that I've just seen them, if they have any problem, anything that they want to ask, not hesitate to contact our secretaries and ask for my input, and I will be immediately responding to their query or to their problem. And sometimes I arrange for them to be seen as soon as possible. So even if the consultation has finished, or even I have discharged the patient, or even if I see them another time, weeks or months later, I kind of try to maintain and continuous communication process, that they are not just discharged or lost. They have a healthcare professional around the problem they mentioned that can be seen anytime and quite quickly, and to feel safe about that this is happening anyway in my practice.